It is with immense pleasure that I welcome you to the July issue of Surgery. This issue, as is always the case, is absolutely chock full of tremendously useful information by world-renowned authors, and in many cases also accompanied by invited commentaries. In this month's issue, we focus on ambulatory surgery centers. We look at surgical site infection for appendectomy, and there's an article which has already gotten a lot of traction with debate and dialogue on social media entitled Acute Cholecystitis. Delayed cholecystectomy has lesser perioperative morbidity compared to emergency cholecystectomy. There's a breast article on persistent and interdependent racial disparities and their mechanisms in post-mastectomy breast reconstruction. 4 separate colorectal articles: anal fissure, J pouches, obstructing colorectal cancer in the elderly, and a very novel article on multi-sensor perfusion assessment to standardize the use of ICG. Our educational article relates to surgical training using a real-time visual computer navigation feedback system. There are articles on thyroid nodules and public perceptions of radioablation versus standard surgery, on outcomes of esophagectomy and on gastrectomy, a predictive technical difficulty assessment tool for thoracic surgery. There's articles on the prognostic impact of lymph nodes in intrahepatic cholangiocarcinoma, on adverse outcome risk factors for hernia surgery. Also, looking at areas on extending antibiotic prophylaxis after pancreaticoduodenectomy, patient engagement, evidence and implementation gaps, prophylaxis for venous thromboembolism, opioid use and its relation to the electronic health record, development and validation of a predictive model for conversion of outpatient to inpatient surgery. There are 6 pancreas articles, as well as coverage for pediatrics, plastic and wound healing, thoracic transplant, trauma critical care, and as always, our highlights and our images in surgery. I welcome you to an outstanding issue. I know after you read the articles in the July issue, you and the patients you treat will derive significant benefit from this outstanding information.